Hello, many of you have been looking for the correct answers for the ICR AIEEA PG 2024 in veterinary science. And many a times you do not find the correct answer and their explanation. So today we have brought in is analysis of the question paper along with the answers, along with the correct explanation of each and every answer for the JRF 2024 in veterinary science. Right? I am Professor GN Purohit, and today we explain many of the whole of the question paper of 2024 held on 29th of June 2024. Right? Uh, we have been conducting many courses through our GNP Sir Classes app, and I am proud and I am happy to say that these are our this year's topper for the veterinary science as well as for the animal science. Now, this list does not include many of them who do not want to or do not wish to disclose their rank before they get their seat allotment, right? So, this list must be much more, and I congratulate all those who excelled, all those who cracked JRF 2024 in veterinary science and in animal science as well. Right? So let us start the question paper analysis. Now, if we look into the question paper very critically, you will find that from veterinary medicine there were 18 questions, from surgery there were 10, from gynecology there were 13, and the highest number of questions appeared from pharmacology. Now, that is why one has to be very, very particular nowadays for JRF. Since 2020, the pattern has changed for JRF. And here you can see the direct questions were 7, the assertion reason type questions were 2, and statement type questions 2, match the following 4, which of the following is true or not 3 from medicine, and likewise from different subjects. Now, if you wish, we will provide this PDF in the GNP Sir Classes app in the free material of the today's lecture, and you can just download the GNP Sir Classes app and have this list, have this today's lecture, right? So there were 48 questions in all from the direct type. There were 9 questions of the assertion reason types. There was statement 1 and statement 2, 10 questions. And then there were 18 questions of the match the following, the list 1 and list 2. And which of the following is true or not true, or arrange them sequentially. There were 35 questions. So you can see from this that JRF for veterinary science has become very tough, but it's not that tough if you sequentially uh, try to prepare for it using the techniques that are required to prepare for it. So, in all, there are 120 questions in JRF, and you can see that out of 120 questions, how many questions have been of what type, right? So, increasing number of the assertion reason, statement 1 and statement 2 match the two lists, or which of the following is true or not true, or are appearing in JRF, right? So we start the analysis of the question paper of JRF 2024, and here you can see that the question number 1, which had the ID 130101, the positive inotropic effects of digitalis is due to inhibition of sodium potassium ATPase pump in cardiac muscle cell membrane, leading to, now these are the options: decreased activity of sodium exchanger causing decreased influx of sodium and decreased efflux of calcium in the sarcolemma. Decreased efflux of sodium leading to less negative resting membrane potential and opening of voltage gated calcium channels on the tubules. Increased intracellular sodium causing increased efflux of sodium and increased influx of calcium through sodium calcium exchanger in the sarcolemma, and increased intracellular sodium decreasing the activity of calcium pump in the sarcoplasmic reticulum. Now the correct answer is the third one. The third option is the correct answer. Why this is the correct answer? Let us discuss. Now the explanation why this third answer is correct, because digitalis exerts a positive inotropic effect primarily by inhibiting the sodium potassium ATPase pump in the cardiac muscle cell membrane. The mechanism can be explained as follows. Inhibition of sodium potassium ATPase, increased intracellular sodium. As sodium accumulates inside the cell, it disrupts the normal exchange, leading to reduced efflux of calcium and an increased intracellular calcium concentration. Increased intracellular calcium is critical for enhancing muscle contraction, which is also known as the positive inotropic effect. Thus, the correct physiological mechanism corresponds to option 3, where intracellular sodium increases calcium influx through the sodium calcium exchanger. This increased calcium ultimately boosts the force of heart contractions, right? So, this is the correct explanation. Now, the question number 2, which of the following statement regarding cytochrome P450 enzymes is correct? They are involved in the production of steroids, is incorrect. Sorry, they are involved in the production of steroids. They absorb maximum light at 450 nanometer wavelength. They are present in the endoplasmic reticulum of the liver cells. They are non-heme proteins. So the correct option is 4, because they are heme proteins, because cytochrome P450 enzymes are heme containing enzymes, heme containing proteins, and not non-heme proteins, right? Then the next question, the ciliated embryophore of Diphyllobothrium latum is called as Miracidium, Procercoid, Hexacanth embryo, Coracidium. The correct answer sequence is 4. Why? Because in favorable environmental conditions, the eggs, after being released in fresh water with the feces of the definitive host, complete their maturation in 8 to 14 days. 8 to 12 days, and then hatch and release a ciliated embryo, the coracidium. So, option 4 is the correct answer, right? So, the next question given below are two statements. As the assertion stratum lucidum is translucent layer present between the stratum spinosum and stratum granulosum, and the reason is stratum lucidum is translucent due to presence of alidine protein. Now the correct option is 4. A is false and R is true. Why? Because stratum lucidum is a translucent layer present between stratum spinosum and stratum granulosum. This is false. The stratum lucidum is a thin translucent layer found between the stratum granulosum and the stratum corneum, not between the stratum spinosum and stratum granulosum. So this is wrong, but the R is correct. Thus, the correct option is 4th. The fourth one is the correct answer, right? Then the question number 5, given below are two statements. One is labeled as assertion and the second is labeled as reason. Assertion is in Brucella antibody, testing, Yersinia infected animals may be wrongly detected as Brucella carriers and so may be killed. The reason is cross reactivity exists between Brucella abortus and strains of Yersinia enterolytica, which is relatively an unimportant organism. The option in 1, both A and R are true, and R is the correct explanation of A. This is correct because false positive Brucella antibody test results can be caused by cross reactivity of antibodies to E. coli, Francisella tularensis, Moraxella phenylpyruvica, Yersinia enterolytica, and certain Salmonella species. So 1 is the correct answer, right? Then question number 6. Now, for these types of explanations, they are present in the notes. What we are providing the notes in the GNP Sir classes app. You can read these notes and easily answer such type of questions. So kindly download the GNP Sir classes app. It's totally free, and in the free material section, you will find many notes which will be helpful. Then spiral colon is characteristic of ox, horse, pig, dog. Choose the correct answer from the options given below. A and D only, A, B and D only, A, B, C and D, A and C only. Ruminants and pigs have a spiral colon. Thus, the correct option is A and C. Ruminants, ox is a ruminant, and pig. This is the correct answer, right? Then bulbourethral gland is compound tubular layer in boar, compound tubular type in bull, absent in the cat, and compound tubular type in the stallion. The correct answer is uh, option 1. Compound tubular type in both. In the both, the bulbourethral gland is very tubular and very large, and it's very compound, and it produces large quantities of the seminal secretions which comprise the heavy volume of the boar semen. And if you just see, we have provided these types the uh, PDF of such type of questions in the GNP Sir classes app for free in the free section, and so you can easily answer such type of questions if you are and then they are absent in dogs and not cats. They are not absent in the cat, they are absent in the dog. Then here is a two lists. The Rivalta's test. Rivalta's test is related to what? Rivalta's test is related to feline infectious peritonitis. Then the Pole test is done for what? Foreign body syndrome. And then the Cassoni's test is done for what? Hydrated cyst disease. And the Hoti's test, this is done for Streptococcus agalactiae. So the correct answer option is 2. Then given below are two statements. One is labeled as assertion and another as reason. Eimeria tenella is the most pathogenic coccidia of chickens and causes heavy mortality in broilers managed under deep litter system. The reason is mortality in cecal coccidiosis usually occurs due to presence of large number of gametogenic stages in the cecal epithelium. Now, the correct option is 3. The correct option is 3. A is true, but R is false. Why? Because Eimeria tenella mainly invades the cecal epithelial cells of chickens and damages the cecal epithelial cell with extensive hemorrhage, causing heavy mortality. It's because of the extensive damage of the cecal epithelial cells, which causes heavy mortality. Then properties of the tungsten that make it good material for making the anode in an X-ray tube are high vapor pressure at high temperature, high atomic number, high melting point, good thermal conductivity. You have to choose which are the properties which make it a good. Tungsten has high melting point to withstand high temperature. Then it has high atomic number to increase the X-ray production efficiency, and it has high thermal conductivity to dissipate heat quickly. So the correct option is B, C, and D. This is the correct answer. So for such type of questions, kindly join GNP Sir classes and join our WhatsApp group. And for you, we have brought in a small course for the clinical subjects, that is the Sushruta batch, the classes of which will be starting from the 3rd of October. And we already have provided the recorded lectures for all the three clinical subjects. And then you will have live classes and MCQ tests as well. So we come to the next question, that is the match the following. So here the correct option is 3. So posthitis, what is posthitis? Posthitis is inflammation of prepuce. Then what is cheilitis? Cheilitis is inflammation of the lips. Then what is funiculitis? Funiculitis is the inflammation of the spermatic cord. And typhlitis, typhlitis is the inflammation of cecum. So the correct answer option is 3, right? Then the match again, match the following type question. The what is cyanide poisoning? Cyanide poisoning, you can use sodium thiosulfate as an antidote. For lead poisoning, what you can use? Calcium disodium acetate. And for trypanosomiasis, what you can use is isometamedium chloride. And for hepatozone canis infection, you can use imidocarb dipropionate. So the correct answer option is 1, right? The most common form of aspergillosis in horses is mycotic abortion, glottal pouch mycosis, renal failure, pulmonary infection. The most common form of aspergillosis in horses is a fungal disease affecting the glottal pouch. So it is also known as the glottal pouch mycosis. So the second is the correct answer, right? Then which of the following immunological tests are not used for diagnosis of schistosomiasis in living animals? The Cassoni test, the torch test, the circadial Helen reaction, and the Frankel's test. Now, the Cassoni test is a skin test used in the diagnosis of hydatid disease. The torch panel test is used to help diagnose toxoplasmal hysteria and other diseases. And the Frankel test is specific to diagnosing toxoplasmosis in animals. So, A, B, and D, which are not used, this is the correct option, right? If instead of this only 1, 2, 3, 4 was given, then the 3 would have been the correct answer. This would have been the correct answer, right? Because the examiner is asking are not used. So you have to rule out the tests which are not used, right? Then praying position in dogs is observed in which of the following clinical condition? Cystitis, meningitis, pharyngitis, pancreatitis. Dogs with pancreatitis may take a praying position with their rear end up in the air, and their front legs and head lowered onto the floor. So, fourth is the correct answer. You can find these type of questions we are sharing in the WhatsApp group. So, kindly join our WhatsApp group, because on a daily basis, we are, irrespective of whether you purchase our app, you purchase our course or not, in our WhatsApp group we are sharing on a daily basis the such type of direct questions and even the assertion reason types of questions. But if you join our group, you will be benefited. You join our WhatsApp group so that you are benefited. We will be providing the link in the description. You can join our WhatsApp group and benefit. Then a 70 kg calf was given a drug X at a dose rate of 100 milligram per kg body weight. The half life of drug X is 10 hours and its initial plasma concentration is 1.9 milligram per ml. True statement about drug X is or are: clearance is around 0.2 liter per hour, volume of distribution is around 0.36 liter, elimination rate constant is 0.00693, clearance is around 0.2 liter per hour. So the correct option is D. This one, clearance is around 0.2 liter per hour, right? Which one of the following is a typical example of uregenous parasite? A parasite that parasitizes unrelated hosts is called an uregenous parasite. Example is trypanosoma and even toxoplasma. So, one is the correct answer. Trypanosoma evansi is a uregenous parasite. Which of the following effects is not associated with the administration of anticholinergic drugs? Transient tachycardia following intravenous administration in dogs, first or second degree AV block progressing to sinus tachycardia in dogs, colic due to ileus in horses, central nervous system depression in dogs. This will cause transient tachycardia following intravenous administration in the dog, right? Given are two statements. One is labeled as assertion and reason. The assertion is potassium Potassium may be supplemented by IV route at a dose of 0.5 milliequivalents per kg per hour in animals, and adverse cardiac effects can occur above 0.5 milliequivalents per kg per hour rate. As a general rule, the rate of potassium administration should not exceed 0.5 milliequivalents per kg per hour. Thus, A is false and B is true. So the correct option is A is false and B is true, the option 4, right? Then seminal vesicles are absent in the boar, the dog, the stallion, and the bull. Seminal vesicles and bulbourethral glands are absent in the dog. This is the correct answer. So if you join our WhatsApp group, you will receive a lot of uh, such type of questions on a daily basis in the group. Irrespective of whether you purchase our course or not, you will get such type of questions to practice on a daily basis. So kindly join our WhatsApp group from the link and you will be benefited. Then the sequence of events that occurs during the process of fever is infection or toxins in the blood, skin vasoconstriction followed by fever, release of IL-1, IL-6, TNF, IFNs, release of prostaglandin E. The correct answer is second. So first what will happen? The infection will happen, and then first the infection will happen, then second release of release of IL-1, IL-6, and then there will be release of prostaglandin, and finally there will be skin vasoconstriction followed by fever. So the correct answer option is 2. Again, the match the following type of questions. The uh, glands of interdigital pouch, they are a tail marker in the sheep. The carpal gland, it is territorial marker in the pig. The circumoral gland is present on the lips of the cat, and glands of infraorbital pouch are rostral to eye in the sheep. So the correct answer option is 1. 1, 4, B2, C3, D1. The plasma membrane of prokaryotes may form stacks or vesicles attached to the inner membrane surface are known as mesosomes, ribosomes, polysomes, and liposomes. Mesosomes are the area in the cell membrane of the prokaryotic cell which fold inwards. So mesosomes is the correct answer, right? Which of the following effects are least observed with systemic administration of glycopyrrolate? Antisyllagogue, tachycardia, ocular effects, and muscle relaxation. Ocular effects are least observed with glycopyrrolate. So the option 3 is the correct answer. The 5 serogroups of Pachyurella multicida identified on the basis of chemical composition of capsular polysaccharides are A, B, D, E, F. This is the correct answer. On the basis of capsular, the Pachyurella multicida had been identified in a number of ways, but on the basis of capsular polysaccharides, this is the correct sequence. Which of the following animals are colon fermenters? You see, the options are elephant, zebra, rabbit, and horse. You see, rabbit is a cecum fermenter. So, elephant, zebra, and horse. This is correct. So, A, B, and D. A, B, and D. So, option 1 is the correct answer, right? Then match list 1 which list 2. Artiodactyl hippopotamus, and then perissodactyl rhinoceros, poikilotherm, crocodile, and metatherian is kangaroo. So this is the correct answer, right? A3, B4, C1, and D2. Then the next question, they match the following again. Palisade worm, Strongyle equinus, twisted worm. Twisted worm is Himoncus contartus, and brown stomach worm is Strategia strategii, and gape worm is Syngamus trachea. So this is the 1, A4, B3, C1, and D2 is the correct answer. Then which one of the following diuretics does not require its presence in the renal tubular lumen for its pharmacological effect? Thiazide diuretics, loop diuretics, carbonic anhydrase inhibitors, aldosterone antagonists. Aldosterone antagonists do not require their presence. So 4 is the correct answers. The number of lumbar vertebrae present in the dog. So this is a very simple question. If you just remember the anatomy, it's 7. The number of lumbar vertebrae in the dog is 7. The narrow space between the particles of podocytes is called the podocytes form the particles, and the particles interdigitate, thereby giving rise to thin gaps called filtration slits. So this is the correct answer. The two major type 1 interferons produced within a few hours of viral invasion are IFN alpha and beta. This is the correct answer. Glandular epithelium of vesicular glands is pseudostratified and columnar type, simple cuboidal type, simple columnar type, stratified columnar type. It is pseudostratified columnar type. So that is the right answer. Carfentanil is used for chemical restraining and immobilization of wildlife species. Carfentanil is a potent synthetic opioid whose action can be reversed by naltrexone. So, carfentanil is considered the most potent for immobilization in most zoo and wildlife species, and its effects can be reversed by opioid antagonist by naltrexone. So, the option 1, both statement 1 and statement 2 are true is the correct answer. Craniocaudally, the parts of colon in ox are proximal loop, spiral colon, distal loop, transverse colon. The first appears the proximal loop, and then the spiral colon, and then the distal loop, and then the transverse colon. So A, B, C, D. This is the correct answer. Then match the following. Infectious agents. What they call infectious agent amongst the option given is only fungi. So it is 4. And then chemical agents. Chemical agents. Can you find out the chemical agent? It is alkali. Then nutritional imbalances, deficiencies in specific vitamins, and immunological reactions are also known as the hypersensitivity reactions. So the 4, A4, B1, C2, D3 is the correct answer, right? Then again, match the following. The pudendal nerve block is done for what? Pudendal nerve block is done for the penis. And then uh, paravertebral nerve block is done for the rumen, and the auriculopalpebral is done for the eye, and tibial nerve block is done for the legs and PES. So this is the correct answer. A1, B2, C3, D4. This is the correct answer. Which of the following anti-epileptic drugs act by the levels of GABA? Tiagabine, ethosuximide, phenytoin sodium, and carbamazepine. Tigabine exerts antileptic effects by blocking GABA take into the neurons and glia. So this is the correct answer. Which of the following is correct for rete testes? It is present in mediastinum testes. It produces testicular fluid. It consists of irregular anastomosing canals surrounded by loose connective tissue. It consists of irregular anastomosing canals surrounded by dense connective tissue. So we are sharing such type of figures, and you can find them in the GNP Sir Classes app. You can find them in our WhatsApp group. In the GNP Sir Classes app, you download it, and you will find that many of these answers can be answered easily. So A, B, and C is the correct answer. If you recollect, this is the diagram, and we have given many diagrams and charts in the GNP Sir Classes app. So kindly download the GNP Sir Classes app, and you will find many of these materials for free in the free materials section. And if you just visualize them and remember them, you can answer the questions like this. You can even join our WhatsApp group, and we are sharing on a daily basis the many MCQs, many reading materials, many charts, which will make you recapitulate what you have already read. Then Thebain. Thebain is from Papaver somniferum. D. Tubocurarin is from Strophanthus gratus, and cubane, sorry, D. Tubocurarin is for this Chondrodendron tumens septum, and C. cubane is from Strophanthus, and then etorphine is for the semi-synthetic opioid. So option 2 is the correct answer. A3, B4, C1, D2. Right? For your practice of these types of questions, we are providing many MCQs in our course. So you can join our course and you will have practice for many similar types of questions. The relevant merits of live vaccines over inactivated vaccines are: fewer doses are required, less chances of hypersensitivity, do not replicate in the recipient, and are relatively cheap. So they are fewer doses are required, they are there are less chances of hypersensitivity, and they are relatively cheap. So A, B, and D is the correct answer, right? So for these types of questions, you have to uh, eliminate the wrong answer, and then you can easily answer. But for this, you have to read thoroughly and very specifically. And we in GNP sir classes provide specific reading, right? Which of the following statements are not correct about first order kinetics? Clearance remains constant, fixed amount of the drug is eliminated, half life increases with dose, and decrease in clearance with increasing dose. The correct answer is B, C, and D. B, C, and D. So B, C, and D is option 3. Relationship between longitudinal axis of the dam with the longitudinal axis of the fetus and parts present towards the birth canal is, you know it very well, it is presentation. Disposition of carbon or coal dust in the lungs is known as siderosis, silicosis, anthracosis, and plumbism. It is known as anthracosis. So it is the right answer, right? Which one of the following mentioned method under alteration of description is practiced among animals by which animal may appear younger? By shopping. Bestiality is not. Bestiality is sexual act with animals. Perjury. So shopping is the right answer. The phase of bacterial growth cycle in which the cells divide at constant rate depending upon the consumption of the growth medium and the conditions of incubation is exponential log phase. This is the right answer, right? Parts of the great colon in horses starting from cranial to caudal are BACD. The right, then the left ventral column, then the left dorsal column, and then the right dorsal column. So BACD, fourth is the right answer, right? Which of the following drugs are non-depolarization neuromuscular blocking agents? Atracurium, succinylcholine, pancuranium, vancuronium. So the correct option is A, C, and D. A, C, and D. So you have to eliminate. So you know that succinylcholine are is not a non-depolarization neuromuscular blocking agent, right? Which of the following drugs can be used to terminate pregnancy in dogs? Aglepristone, PGF2 alpha, dexamethasone, cabergoline, and cloprostenol. So all can be used for pregnancy termination in the dog. So A, B, C, and D. The third is the right answer. Normal serum calcium level in cattle is 8.5 to 10 milligrams per deciliter. This is the right answer. Button ulcers in colon of pigs are seen in classical swine fever, toxoplasmosis, intestinal salmonellosis, Glasser's disease. They are seen in classical swine fever and intestinal salmonellosis. So A and C is the right answer. Option 2 with A and C is the right answer. Plicae circularis of small intestine are permanent folds in ruminants. So this is the right answer. Slime balls of Dicrocilium dendriticum are aggregations of sporosis, rhedia, cercaria, metacercaria. They are aggregations of cercaria. So this is the right answer. We are sharing a lot of such type of questions in our WhatsApp group. So kindly join our WhatsApp group through the link given in the description, and we are providing similar type of many questions and their answers on a daily basis. So join our WhatsApp group and be benefited. Statement 1: most IgE is bound to tissue mast cells and occurs in extremely low concentrations in serum. IgE cannot act simply by binding and coating antigens as the other immunoglobulins do. So, during an allergic response, IgE released from beta cells will bind to mast cells, blanketing the plasma membrane of these immune cells. So, both statement 1 and statement 2 are correct. This is the right answer. For such type of answers, for such type of attempting such type of questions, you can refer to the notes in GNP Sir classes in our app, and we will provide additional notes for those purchasing our course, the Sushruta batch, and you will have access to uh, all all the premier material to read so that you can answer these types of questions very easily. So join our Sushruta batch, classes starting from 3rd of October. You still have time, and we are providing a discount of rupees 300 till a few days. Kindly join very fast, right? Then the external ear is related to ectoderm of the first bronchial groove, and the middle ear is related to the endoderm of the first pharyngeal pouch, and the inner ear is related to the ectoderm lateral to developing hindbrain, and retina is related to neuroectoderm. So the correct answer option is 3: A2, B1, C4, D3. This is the right answer. Dogs with which of the following mutation are predisposed to increase sensitivity to ivermectin and moxidectin? The dogs with ABCB1 are more exposed to increased sensitivity to ivermectin and moxidectin. So, this is an interface of our courses which we are offering. You can join our courses and you can benefit. The Susruta batch is going to start very soon, and uh, the classes, live classes, will start from the 3rd of October 2024, and we will be completing it. We are providing the schedule of the live classes, schedule of the mock test, and the chat support to each one of you. You can also visit our website www.gnpsirclasses.com, and you can download the GNP Sir Classes app where you will find a lot of courses of your interest. You can see here last year we had the test series as well, online test series, online test series, and then the courses for the animal science, the online test series, and the courses for veterinary science as well. We also have courses for the veterinary officers. So you can join our classes, you can visit our website, and you can be benefited for your preparation. Then the next question, the main causative agents of the disease mucormycosis belong to the order. Mucormycosis is an infection caused by fungi belonging to the order Mucorales. So option 4 is the correct answer, right? The polyether inoporous antibiotic with potential anticoccidial action is arprenorcid, halofuginol, monensin sodium, robanidine. Monensin is an inotropic antibiotic used to treat bacterial, fungal, and parasitic infection. So option 3 is the correct answer. Then again match the following. The cystosoma species is the treatment is praziquantel. For the fasciola, the treatment is triclopentazole. For for poultry cystodes, butyrate is the correct drug, and for Dictyocalus filaria, ivermectin is the correct drug. So A2, B4, C1, and D3. This is the correct answer, right? In stallion, testosterone is produced by the Leydig cells, by the seminiferous tubules, by the epididymis, and by the prostate gland. Prostate gland does not produce any testosterone, and similarly, seminiferous tubules do not produce any testosterone. So the correct answer is not shown here, but the correct answer would be A and C. The Leydig cells as well as the epididymis produces large quantities of testosterone in the stallion species. Given below are two statements. Warts in cattle are caused by papilloma virus. Ringworm in cattle is caused by trichophyton species. So both are correct because warts are caused by papilloma and ringworm is caused by trichophyton species. So both A and statement 1 and statement 2 are correct. This is the correct answer. Absence of pathogenic microbes or infection in living tissue is termed as antisepsis, asepsis, disinfection, sterilization. Asepsis is the state of asepsis is the state of being free from disease causing microorganisms. This is the right answer. Heavy infection of Aeregus pericicus results in anemia and the egg laying drops or completely stops in fowl. Control of Aeregus persicus is difficult as it attacks the birds at night and larvae and nymphs drop off after feeding for about 2 hours. In light of the above statement, which is correct, both statement 1 and 2 are correct, right? So option 1 will be the correct answer. Adaptive immunity is always turned on by antigens, and the cells engaged are T cells, NK cells, dendritic cells, B cells. So you have to choose which are the correct ones. It is caused by the T cells and the B cells. So A and D is the correct answer. Adaptive immune response are characterized by different classes of lymphocytes called the B cells and the T cells. A zookeeper was accidentally bitten by a captive snake on the hand. The hand showed local tissue damage and discoloration, oozing of blood from fang wounds, swelling, and local suppuration. The snake could be banded krait, black mamba, Russell viper, king cobra. The cobra and krait venoms are neurotoxic and cardiotoxic. So local effects are seen in the former but not in the latter. Viper venom is vasculotoxic and has severe necrotizing local effects. So probably the person was bitten by the Russell's viper. Which of the following is used for hormonal testing of subfertile and infertile stallions? So all can be used for A, B, C. serum FSH, single phase GnRH, HCG stimulating, but progesterone treatment is cannot be used for of use in stallions. So A, B, and C is the correct answer. Biting midges are characterized by mottled appearance in wings. Thorax is humped over the head. Piercing mouth parts. Antenna is three segmented. They have mottled appearance, and their thorax is humped over the head, and then antenna is three segmented. So option 1 is the correct answer. Which of the following synthetic material is not used for vascular and cardiac surgeries? Polypropylene, polytetrafluoroethylene, Dacron, polyoxymethylene. Polyoxymethylene is also known as acetal or Delrin. It should not be used in cardiac surgeries due to the following reasons: lack of biocompatibility, poor hemocompatibility, structural degradation, and potential for leaching of toxic substances. So, polyoxymethylene is the correct answer. Which of the following situation indicate a state of premunity in bovine tropical theileriosis? Low erythrocytic infection with absence of KBB, high erythrocytic infection with absence of KBB, high erythrocytic infection with high number of KBB, low erythrocytic infection with high number of KBB, low erythrocytic infection with absence of KBB. This is the right answer, right? You can find such type of questions in our WhatsApp. We share on a daily basis. Kindly join our WhatsApp group. We will provide the link in the description section so you receive the daily input from us. Which of the following is not a component of intra-abdominal tunic surrounding the testicles? External spermatic fascia. This is not the component of intra-abdominal tunic. So this is the right answer, right? Which type of chorioallantoic placenta is present in male? You see, many times questions are asked almost every alternate year or every year from either the type of placenta in one or other species or the gestation period of one or other species. So we are focusing on such type of things from where questions are asked. So join GNP Sir classes, download our app, the GNP Sir classes app, and we will provide you many things for your use. Right? So coming to this question again, the placenta of mare is diffuse, it is villous, it is epitheliochorial, and it is non-deciduate. So A, B, C, and D is the correct answer. The anticholinergic drugs are not commonly used as anti-sialagogue in ruminants. Administration of anticholinergic agents make the salivary secretion thick and viscid, thus predisposes to airway obstruction. So both are correct. That is why the uh, anticholinergic drugs are not commonly used as an anti-sialagogue in ruminants. So both A and R are correct, and R is the correct explanation of A. This is the correct option. The factors that are associated with high complication rates in esophageal surgery are the lack of segmental blood supply, the lack of serosa, presence of thick omentum, continuous gulping movements due to saliva. A, B, and D are correct. So A, B, and D only. So the option 3 is the correct answer for this question, right? Then here are some uh, two lists to match, and the first one, triorthocrysyl phosphate. Triorthocrysyl phosphate is used for delayed neurotoxicity. Then paraquat is used for pulmonary fibrosis. And then deltamethrin is used for CS syndrome. And dinitrophenol is used for delayed neurotoxicity. So A3, B1, C4, D2. This is the right answer, right? Epithelial pearl is a feature of chondroma, osteosarcoma, chondrosarcoma, squamous cell carcinoma. Keratin pearls and epithelial pearls are variants of disc keratosis found in connective tissue in cases of squamous cell carcinoma. So, squamous cell carcinoma is the right answer. Find detailed explanation for similar questions and other questions in the materials in GNP Sir Classes app, where you will find charts, concise figures, and much more. Download the app and benefit. Join our WhatsApp group. Then the next question, the pox viridi. Pox viridi Pox viridi involves the Golgi membrane, herpes viridi, nuclear membrane, rhabdoviridi, plasma membrane, and coronaviridi, endoplasmic reticulum. So A1, B2, C3, D4. This is the right answer, right? So next MCQ, the vasodilation. Yes, vasodilation is more involved with nitric oxide and then increased vascular permeability, C5A, increased vascular permeability. Increased vascular permeability is with histamine, and chemotaxis and leukocyte activation is more with C5A. This one is wrong. And then fever involves the IL-1 and IL-6. So A3, A3, A2, B3, C1 and D4. This is the right answer, right? The yolk sac involutes 3 to 4 weeks after conception in the pig. This is the right answer. The sequential arrangement of parts in the leg of an insect is claw, coxa, femur, tarsus, tibia, trochanter. So you have to choose the correct sequence. So the first is the coxa, then the trochanter, then the femur, then the tibia, then the tarsus, and then the claw. So this is the correct sequence. So B, F, C, E, D, A. This is the right answer, right? So carbapenems are sensitive to extended spectrum beta lactamases. This is the statement 2. The statement 1 is time of drug concentration above minimum inhibitory concentration is important for clinical success in case of treatment with beta lactam antibiotics. Now, statement 1 is true. This is true. But the statement B is false. This is not correct. So the correct answer is statement 1 is true, but statement 2 is false. Option 3. Branches of the abdominal aorta from cranial to caudal are cranial cranial mesenteric artery, external iliac artery, renal artery, celiac artery. So the first is the celiac artery, then is the cranial mesenteric artery, and then is the renal artery, and then is the external iliac artery. So DACB. This is the right answer, right? A wet dog has a typical odor. The typical odor of a wet dog is due to secretion from sebaceous glands of the skin. Yes, both are true, and the explanation is correct. So, option one is the correct answer, right? Hemorrhagic nodules in peritoneum of right abdominal flank of equine are produced by the larvae of Strongylus edentatus, right? So that is the right answer. Kindly join our WhatsApp group where we are sharing a lot of material, and we also provide you many reading material, many MCQs. So kindly join our WhatsApp group and receive the benefit of regular receipt of MCQs, regular receipt of reading material, and much more, right? And guidance and doubt clearance and much more. You can also join our GNP Sir Classes app, download the app, and you will find much of the reading material in the app. Shock in case of burn is an example of shock in case of burn is an example of vasogenic shock, septic shock, cardiogenic shock, and hypovolemic shock. It is a hypovolemic shock. So that is the right answer, right? For activation of the complement system, the innate pathways involved are the amplification pathway, the classical pathway, the lectin pathway, the alternative pathway. So, the lectin and the alternative pathway are required for activation of the complement. So, C and D are correct. And so, the option having C and D, so option 4 is the correct answer. Swollen fiber, dark red or black colored liver is observed as a constant feature of which of the following disease of broilers? Fowl typhoid, pullorum disease, avian leukosis complex, and infectious bursal disease. Clearly, it is for fowl typhoid. So that is the right answer. Invariably, the symmetry of isometric viruses is complex, icosahedron, helical, rotational. It is icosahedral. So it is icosahedron. Secondary photosensitization occur after the ingestion of Parthenium hysterophorus, Phlegopyrum esculentum, Hypericium perforatum, Lantana camara. Lantana camara causes secondary photosensitization. Right? So that is the right answer. The envelope spikes of all paramyxoviruses are composed of the fusion protein and the HN glycoproteins. F is responsible, the statement 2, F is responsible for the fusion of the viral envelope with the plasma membrane of the host cell. So, statement 1 is false. This statement is not correct. But the statement B is correct. So, the correct answer is 4. Parasite which causes both VLM and CLM is Gnathostoma spinigerum. So this is the right answer, right? In ultrasonography, the axial resolution and the maximum available depth of examination is higher for higher frequency transducers. The high frequency transducers produce shorter pulses with long pulse interval and are attenuated early in the tissues due to higher number of interactions. So A is not correct. This is incorrect. So the option A is not correct, but R is correct is the right answer. All of the following anti-diabetic drugs act by enhancing insulin secretion except exenatide, sitagliptin, rosiglitazone, and ripaglinide. It is rosiglitazone, right? So option 3 is the correct answer. The sequence of changes occurring in coagulative necrosis is membrane damage, cell swelling, chromatin clumping, organellar swelling. So the uh, correct sequence is B, C, D, A, right? So option 3 is the right answer. Which of the following statements are not true about type B adverse drug reaction? Qualitatively abnormal responses to the drug, predictable from the drug's known pharmacological or toxicological effect, generally dose dependent, usually common. B, C, and D. So option 3 is the right answer, right? Then match the following. Morphine is an opioid agonist. Buprenorphine is a partial opioid agonist. Butarphenol is a opioid agonist antagonist, and naloxone is a opioid antagonist. So A4, B3, C2, and D1 is the correct answer. Right? You see, many questions are appearing of these types, and we are providing many of these types of questions for your practice, for your help, and you can join our course, the Sushruta batch, and then you will receive many of the MCQs of similar types. The, but the major thing is, if you read carefully, you can answer any of the MCQs that are appearing in any exam. So you, for careful and for selective reading, we are providing the material for careful and selective reading. So join us to have a selective and careful reading. The cluster of polypeptides forming morphological units on the surface of icosahedral viral particles are capsid, nucleocapsid, capsomeres, and envelope. They are the capsomeres, right? So that is the right answer. On echocardiography, dilated cardiomyopathy in dogs is characterized best by which of the following? Decreased ejection fraction, decreased fraction shortening, increased mitral wall, E point to septal separation, decreased LA-AO ratio. There is decreased ejection fraction, there is decreased fraction shortening, and then there is increased mitral wall E point to septal separation. So A, B, and C only. This is the second one is the right answer. In ox, valate papillae are 8 to 17 in number on either side of the caudal parts of the fibrous lingae, 18 to 24 in number of either side of the cranial parts of the torsus lingae, 8 to 17 in number on either side of the cranial parts of the torus lingae, and 18 to 24 in number on either side of the caudal parts of torus lingae. So they are 8 to 17 in number on either side of the caudal parts of the torus lingae, right? Sequentially arrange the following life cycle stages of exodid, ticks, larva, adult, nymph, and egg. So, what will be the first? You can just guess. First will be the egg, then there will be the nymph, and then there will be the larva, and then there will be the adult. So, A, D, C, A, B. Sorry, D, A, C, B will be the, this is the right answer. Larva, first larva and then nymph and then adult. Right? For the same amount of absorbed dose in gray, which of the following will produce maximum ionization and biological hazard? X-rays, gamma rays, beta particles, alpha particles. The alpha particles will produce the maximum ionization and biological hazard. Right? So this is the right answer. Babesiosis is caused by extra erythrocytic parasite in bovines and is transmitted transovarially by Rhipicephalus or Boophilus microplus ticks. Babesia bovis is the small form in cattle, while Babesia canis is the large form in dogs. The Babesia, this statement is correct, but the statement 2, sorry, this one is incorrect. And the uh, Babesia, the statement 2 is correct. So, statement 1 is incorrect and statement 2 is correct. This is the right answer. Anaerobic bacteria are intrinsically resistant to beta-lactam, aminoglycosides, chloramphenicol, metronidazole. They are intrinsically resistant to aminoglycosides. So this is the right answer. Kindly join our WhatsApp group. Kindly download the GNP Sir Classes app and join our Sushruta batch for uh, preparing yourself not only for your JRF 2025, but joining our Sushruta batch right now will also help you in your composite exams. Will provide the link below in the description. Kindly join the course right now. Keratinocytes contain melanin pigment in the form of melanosomes. Melanin pigment is produced by keratinocytes with the help of tyrosinase enzyme. Now, statement 1 is true, but statement 2 is false. So, the this is the right answer, right? Most instances of immune dysfunction fall into which of the following broad categories? Hypersensitivity, immune imbalance, immune deficiency, autoimmune disease. So, all of them are correct. So, A, B, C, and D. This is the correct answer. The sequence of structures through which light rays pass inside eyes before reaching into retina are cornea, lens, vitreous body, aqueous humor. A, B, A, D, B, C. This is the right answer, right? Feline panleukopenia is also known as feline peritonitis, feline parvoviral enteritis, feline rhinotracheitis, feline pneumonia. It is known as the feline parvoviral enteritis, right? So this is the right answer. A certain reason transducer should be placed perfectly parallel to the blood flow in to get an isolation angle of 0 to 180 degrees at the time of Doppler and ultrasonography. The reason is at an insonation angle of 0 to 180 degrees, the transducer receives maximum Doppler shift from the blood flow. So what is the both A and R are correct, and R is the correct explanation for A. Right? So this is the right answer. Arrange the families of bear, deer, wolf, and antelope in correct order. So C, B, D, A. C, B, D, and A. This is the right answer. So match the following. Breech presentation is bilateral hip flexion. Monster, which is a monster? Amorphous globosus is a monster. And stillbirth, birth of dead fetus, and Banks disease is also known as brucellosis is also known as Banks disease. So this is the right answer. A3, B4, C1, D2. Right? Arrange the adverse effects of chloramphenicol, tetracyclines, aminoglycosides, and sulfur diazine in the correct order. So C, B, D, A. This is the right answer, right? Mixer edema on the forehead and face resulting in a puffy appearance and thickened skin fold above the eyes is most common in hypothyroidism. Above described signs are also important clinical signs in case diabetes mellitus. So statement 1 is correct, but statement 2 is incorrect. So that is the right answer, right? Which of the following is true for mast cells? These cells are common in loose connective tissue. These cells take metachromatic stain. These cells are rich in histamine, heparin, and proteases. These cells contain basophilic cytoplasmic granules. So A, B, C, D. This is the right answer, right? Then again match the following. Hydroxyquinone is a reducing agent. Sodium carbonate is an accelerator. Potassium bromide is a restrainer. And sodium sulfite is a preservative. So A3, B4, C1, D2. This is the right answer. Right? Which of the following species has cotyledonary placenta? Of course, it's very clear. It's cattle which have a cotyledonary placenta. Join our WhatsApp group. Kindly join our WhatsApp group and download the JNP Sir Classes app and join the Susuta batch. Classes starting from 3rd October. We will provide you all support uh, for your preparation for JRF 2025. In this course, we are providing for the clinical subjects, right? The animals infected with Theileria annulata are cross protected against Theileria parva infection. Protective immunity in Theileria parva is conferred by cytotoxic T lymphocytes, which cause lysis of parasites by osmotic alteration in target cells, leading to swelling and disruption of the cells. The statement 1 is incorrect. The statement 1 is incorrect, but the statement 2 is correct. So, fourth option, statement 1 is incorrect, statement 2 is correct, is the right answer. Macula densa is a patch of densely packed epithelial cells present towards renal corpuscle side, in distal straight tubule, in distal convoluted tubule, in afferent tubule. Is present towards renal corpuscle and it is in distal straight tubule. So A and B is the right answer, right? Then match the following again. FSH released from the pituitary, PGF2 alpha from the uterus, GNRH from the hypothalamus, and ECG from the placenta. So A4, B3, C2, and D1 is the right answer, right? Tetracyclines inhibit protein synthesis and exhibit broad spectrum bactericidal effect. Tetracyclines bind to 30S subunit and inhibit the binding of amino acyl tRNA to A site. So A is false. So A is false, but R is true. That is the right answer. Which of the following is the most common cause of dystocia in cattle? Feto-maternal disproportion is the biggest cause of dystocia in cattle. Uterine inertia is the biggest cause of dystocia in dogs. So, this is the right answer. In the GNP Sir Classes app, you will find many charts from which you can directly understand many things directly. And you can remember them easily as well. Which of the following, the last question of 2024 JRF Veterinary Science question paper, which of the following statements are true regarding brucellosis? Necrotic placentitis is frequently encountered. Hygroma and joint inflammation occurs in chronic cases. Humans can get infected through intact mucous membranes. Abortions generally occur in the first half of gestation. No abortions occur during the last half of gestation. So A, B, and C. A, B, and C. So option 2 is the right answer. Hope you enjoyed this today's explanation of all the questions of JRF 2024 veterinary science, and we will be glad to see you in the app. We will be glad to see you join our WhatsApp group, and we will be glad to see you in our course Sushruta batch starting from 3rd October, wherein we will be providing, we have already provided 9 recorded lectures, and we will be providing uh, live classes and mock tests and chat support and reading material as well. So you can answer any of these types of questions by reading through the notes we are providing in the our courses, and you will be really benefited. You will attain, as this year many have attained the top positions. Maybe it's you who will be on the top for the forthcoming examination. So thank you very much. Kindly like, share, and subscribe GNP Sir channel. Kindly download the GNP Sir classes app. We will provide the link in the description below, and kindly join our WhatsApp group so that you receive the support from us on a daily basis. Thank you very much. See you in the course. See you in the WhatsApp group. See you in the app. Bye bye. Have a nice time.